Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back to the show. We are excited to have our next guest back with us today, Scott Hettesheimer. Maybe you've heard him before here, seen him on the podcast. He is the president and founder of Advanced Benefit Design Institute, and we're excited to have him back to talk more about healthcare expense reduction. Also, we're going to talk today about claim auditing and move on into more of the pharmacy side, but he's really here helping to identify, healthcare costs and to prevent overcharging and fraud and to help so many people in the healthcare business. Welcome back. How are you?
Very good. Thank you, Jill.
Great. Well, pleasure to have you here. Just to get started, tell us how we can reach out to you.
Sure. The URL would be theabdi.com. We are a next generation claim auditing service.
Okay.
Which next generation, that's very important because our service not only researches 100% of a self-insured employer's claims, and not just last year, we go back 3 years, but we pick up the pharmacy claims as well, and we don't have limitations in our auditing per se that other vendors or services would have that are restricted by network agreements and negotiated pricing, so on and so forth. So we always find more overcharging, which overcharging is a combination of overbilling, fraud, greed, just abuse in general.
Yeah.
It's also classified as stolen money from the employer. So yeah, we go after that. We find it, we go after it. We have a full legal team assembled when necessary. Generally, it's not needed, but when it is, it's good to have that in-house. And then after finding that money, we recover it and return it back to the employer and the plan members who have paid excess deductible coinsurance, so on and so forth, in their healthcare claim. Claim auditing, from what I've been told, is the #1 Google search term right now. So it's something that most CFOs have been, I guess you'd say, introduced to and realize the importance of checking the claims that have been adjudicated and paid. So
could you tell us? Well, yeah. So for someone on the outside, claim auditing. So that's the process of your, going over all the bills. Is that just kind of generally how you would say it?
Our service will re-adjudicate, which means they look at every submitted claim, and then we re-adjudicate the claim, which could be using different formulas and processes than the claim adjudication service that's built into your current administrator. So, we're checking the supposed checkers in your benefit solution. So we re-adjudicate the claim, and we find about 25% inaccuracy. So if you have $10 million in paid healthcare claims, 25% of that would probably fall into that overcharging. Now, that is a number that came from HHS, which is Health and Human Services. That's a number from the government. And that's not a number that they identify and attribute towards Medicare or Medicaid. That's what they find in the healthcare delivery system as a whole. So, it's a big deal. It's a lot of money. When we're gonna have a number for 2023 very soon and we expect it to be 1,400,000,000,000, 1,700,000,000,000. That would be the dollar amount of overcharging throughout the country. So, we're talking about big numbers here.
Got it. And I know you're going to migrate over to talk a little bit on the pharmacy side today as well, right?
Yes, the last podcast, I got into the healthcare charges. That would be consumed healthcare that an employer paid for in their benefit plan. We work with employers that have 500 employees or more. We're currently working one that has 100,000 employees. So, and we work nationwide. You can reach me at 513-720-4400, and we can get started on your benefit plans as soon as you like. We do not charge for our analytics, our re-adjudication process. We do all that up front. And if we do not find overcharging and then recover that overcharging, we don't have a fee. So we only get paid if we're good. We only get paid if we perform. We only get paid if we recover money that was stolen from your benefit plan. So today, I want to get a little bit more into the pharmacy part of this equation, because there's just a huge amount of money that's being overcharged in the RX portion of a benefit plan. So first of all of the PBMs, which would be pharmacy benefit managers, they all say they're transparent, but there's no definition of transparency. And if you don't have a definition of transparency, what does it mean to be transparent?
Yeah.
Well, obviously, especially in our case, it means something different to every vendor in the marketplace. So transparency is not the answer. So when CFOs and HR, when they're looking for a pharmacy benefit manager, commonly known as a PBM, just because they're transparent doesn't mean you've got the right vendor. You need a vendor that is not only transparent, 100% transparent, but also does business to a fiduciary standard.
Okay.
The number of fiduciary PBMs that are actually doing business, it's a very small number. You're not going to see that advertised in most PBMs because they don't do business to a fiduciary standard. All of our solutions, all of our vendors, whether it's in the healthcare space or in the PBM space, they're all fully vetted to our standards, and we publicize what our standards are, and we'll explain the importance of that. But they all do business to a fiduciary standard. That's like your financial advisor. Financial advisors do business to a fiduciary standard. That's commonplace. I'm not going to say 100% of them do, but they're supposed to. So we operate to the same standard as your financial planners do. So the fiduciary branding, the fiduciary name, that's important. Hard to find, but we have 3 or 4 different PBMs that do business to a fiduciary standard. Another key item, it's important that your PBM owns its own contracts. Most PBMs do not own their own contracts. We have what we call or identify the big 3 as far as PBMs go. Your Caremark, Optum, things like that. Those are common names. They have 80% of the business in the marketplace.
Wow.
None of them do business to a fiduciary standard, and none of them are transparent as far as our definition of transparency goes. So doing business with any of the big three, we'll probably find 20, 25, 30% savings just by changing PBMs. And when you change from one of the big three PBMs to us, you can still fill your drugs anywhere you want.
Mm-hmm.
It's not like our PBM only has one pharmacy in your market that you can go to. You can still go to your grocery store for drugs. You can still go to Walgreens, CVS, mom and pop pharmacies, Costco, Sam's, wherever you get your drugs filled. We have 66,000 pharmacies that fill drugs with our PBM relationship that we recommend. So, it's important that your PBM owns its own contracts, because otherwise that just inserts another middleman or two or three or four who are going to derive revenue off of your pharmacy fills. So when you're trying to reduce your spending, you need to get rid of these entities that participate in the supply chain of your drug fill. Conflicts of interest. You don't want your PBM to own a product, a pharmacy, a dispensary, or preferred medication. You want your PBM to be agnostic. And, with that being said, you are truly getting the result of shopping for the lowest price if your PBM does not have a conflict of interest. Every time you run into that conflict of interest, you're going to be directed to their particular pharmacy or their particular formulary for the drug fill, and you're going to be overpaying. So, you don't want a PBM that has any conflicts of interest. So, these are just some tips, I guess you'd say, if you're trying to actually control cost. We're not going to be able to recover money from your pharmacy relationship, but we can change your pharmacy relationship, and we can stop the bleeding as far as these high or highest drug costs in the industry go. The other thing is how they derive their pricing. Most of the PBMs have a spread pricing model. And that's, the spread is from the actual ingredient cost to the average wholesale price that you see in the pharmacy. There are about 10 or 12 steps of increase from the actual drug cost to the average wholesale price. What you want is a PBM that has a fixed fee or a fixed price that they have included in the price of the drug, which represents their revenue. It's simple. It's a price per prescription, and that's all you have to pay. This spread pricing could take you from a $7.95 ingredient cost to an $87 average wholesale price. In our scenario, you just have your dispensing fee per prescription that's added onto the price. You're not going to find those huge markups on absolutely every drug filled. We have some nice tools offered to employers from the PBMs that we represent. As an example, there's an application that can be downloaded to the smartphones. You can put your prescription, your drug fill into it. And of course, you put your marketplace, where you're going to go, that kind of information. And it's a shopping tool. It'll show you the different cost, your out-of-pocket cost at the various pharmacies on the particular day that you're going to get your drug filled. The reason I word it that way is because the costs of drug fills can vary daily within the same pharmacy, same drug. They still can vary daily. The drug pricing is not fixed for the month for the week, for the day, or even for the year. They're variable. They change they can change every time you get your drug filled. So we have an app that will identify the lowest cost, your out-of-pocket cost, and of course it's going to be the lowest cost to your employer because your employer is self-insured and they're paying the real cost of healthcare 100% out of their bank account. So when you're an employee of a company that's self-insured, it would be nice if you would be a steward, if you will, and try to do a little shopping to find the best pricing on your consumed healthcare, whether it's doctor visits, surgeries, or drug fills. So there are a lot of benefits in going to a different PBM. We have a few minutes left, I guess, Jill, right? What about 5-10 minutes?
You're good. Yeah, we got
Good.
7 minutes.
Okay. I have an analysis from a 200-man group, actually about 225 employees. They had 2,474 prescriptions filled, which totaled $551,636. Now that's what the employer paid out of their bank account through their self-insured plan offering. Now, you could say, well, maybe if they had more generic utilization, or maybe that was the problem. Their drug cost name brand was too high. Well, that's not really the case because they had a 86% generic utilization.
Wow.
So, that's a good number. After we analyze the claims data, we estimated the drug savings, assuming that the drug fills would be the same this year as they were last year. Last year is all factual information. Assuming their employees, covered members, had the same or will have the same drug fills for 24 as they had in 23. That's an assumption that we make.
Yeah.
So we found that we could have saved upwards, the best case scenario, 277,335. That literally cut the drug spend in half. If we would have had minimum engagement, nobody wanting to use any of our new processes or vendors, we would have saved a minimum of $12,000.
Wow.
So, it's important that we have buy-in from upper management and the employees to, let's just say, learn a different way to fill their drugs. It's kind of like, everybody with their vehicles needing oil changes. What do? You just drive into the dealer, drive into anybody willy-nilly and get the oil change. Most people spend more time shopping for the lowest cost oil change than they do, than they absolutely, that's an absolutely, than they do shopping for healthcare or shopping for drugs. People just don't care or know that you can shop, or they don't have the tools. So, it's important that we accomplish an education, if you will, on becoming better healthcare consumers. And that's part of what we do as well, part of our services. But getting back to the pharmacy thing, there's such a thing called rebates when you're talking about these drug fills. And in this particular scenario, we found $137,360 in rebates. According to ERISA, and ERISA is federal law, rebates belong to the plan sponsor. The plan sponsor is the employer. So all drug rebates, according to federal law, are supposed to go directly to the employer. This employer didn't even know what a rebate was. And, when I told them that there were $137,000 in rebates and they didn't get them, they were quite upset. Generic, everybody thinks generic is the best, lowest pricing, but that's not always the case either. The percent of profit is higher with a generic than it is a name brand, or maybe even a specialty drug, a drug that costs 12, 14, $16,000 a fill, one fill per month. We found $94,000 in savings by doing a better job managing and distributing the generics. So, we have very detailed reporting that we provide, that we generate in our work. And again, we don't charge for this reporting. So anybody that wants, any employer, any CFO with, an employer group of 500 plus employees, call me and I'll set up this deep dive into your claims data. And we'll generate these reports and identify this money. And again, we don't charge to do this reporting. We just take a percent of what we actually recover in savings. Now, in the event of the PBM, we would have to switch it to a PBM because again, we can't recover these dollars from the PBM. We can recover dollars from hospitals, doctors, medical facilities.
Got it. Well, thank
There-
you for enlightening us on this whole thing. We still got 2 more minutes left.
Okay. Well, we identified some top 10 drug savings.
Yes.
Most of this stuff I can't even pronounce, but Lexapro,
Mhm.
Vascepa, Symbicort, Oxycontin, Cilantra, Adderall, Clarivis, Eliquis, atorvastatin. These are very common drugs. Atorvastatin, that's a high cholesterol drug.
Mhm.
Many of these are diabetes drugs. There's a painkiller in there. But we found over $19,000 in savings just in enforcing rules with the top 10 drugs. And then there's another final topic, and that's your international fill. Yes, we absolutely do international fill. But what we find out is some of these companies doing international fills are doing a spread pricing model. They take a percent of what they save. That will generate 5, 6 times the cost to a plan over than doing a PEPM, per employee per month fee. So it's better to pay for the service than to agree to pay part of the savings generated when you're working with companies that offer the international drug fill service as an add-on to your PBM. But some of these drugs, Humira, Januvia, Skyrizi, Jardiance, Ozempic. These are $7,000 to $30,000 a month drug fills.
I can't believe how expensive that's, that my girlfriend is taking that now. And I'm just like, what? Yeah.
Trulicity, you see that on TV all the time. We see that being charged at like $1,700 a month. That's a once a week shot.
Wow.
I mean, it's, these things are very expensive. Eliquis, the blood thinner, that's actually going to be a generic. Maybe this year, I think, is when the date comes up. But currently, that's like $550 a month. And you take 2 pills a day. That's your prescription. We can reduce that cost to 0 for an employer.
Wow.
We can reduce that cost to $25 for an employee that's taking it, instead of a high formulary, non-brand, whatever you want to call it, copay, which generally is a minimum of $50. So that's a 50% savings for the member.
Wow.
So again, we're at theabdi.com. My direct line is 513-720-4400. We don't use any automated phone systems. When you call that number, my phone rings in my pocket.
It's always good to get a human, right?
That's right.
Doesn't happen much these days.
I hate the what do they call that? The automated phone answering stuff.
Yeah. Oh, I can't.
I can't
know.
stand that.
I know.
Press 1, press 3. No, we don't do that. We don't like it. I don't want it for myself, and I don't put my customers through it.
Yeah. So remind us of how we can contact you. Want to tell us the phone number?
Sure, 513-720-4400.
Perfect. Thank you so much. And the website again, Advanced Benefit
A,
Design
no,
Institute,
the
or
ABDI. We give a simpler URL. Yes, we
perfect.
still have the old one, Advanced Benefit
I'm
Design
sorry, that's the only
Institute.
one that's on my sheet, so I always say it. But
But
it
we found
still
a new,
works.
we found a new URL that's
All
simple.
right,
It's
good.
just theabdi.com.
Thank you again. Pleasure having you back, Scott, and looking forward
Thanks,
to the
Jim.
next time we talk. Thank you.
Okay. Uh-huh.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.